Welcome to this complete pediatric nursing guide on fontanelles, often referred to as Fontanelles. This video will cover essential aspects of these anatomical features. Fontanelles are derived from the Latin word fontanella, meaning little fountain, due to their pulsation. Defined as the soft spots on an infant's skull, they are wide gaps between cranial suture lines, covered by a tough membrane. Fontanelles serve two primary functions. First, they allow for molding, where cranial bones overlap during birth to reduce head diameter. Second, they accommodate rapid brain growth, which doubles in size in the first year. A newborn has 6 fontanelles, 1 anterior, 1 posterior, 2 paired sphenoid, and 2 paired mastoid. The anterior fontanelle, also known as the bregma, is the largest. The anterior fontanelle, or bregma, is located at the junction of the sagittal, coronal, and frontal sutures. It is diamond-shaped and the largest, measuring approximately 2.5 centimeters to 4 centimeters in its anterior-posterior diameter. To measure the anterior fontanelle, calculate the average of the anterior-posterior and transverse dimensions. Very large fontanelles, greater than 5 centimeters, may indicate conditions like hypothyroidism, while very small ones might suggest microcephaly. The closure time of the anterior fontanelle is frequently tested. It normally closes between 12 and 18 months, or 1 to 1.5 years of age. The posterior fontanelle, or lambda, is located at the junction of the sagittal and lambdoid sutures. It has a triangular shape and is much smaller, typically measuring 0.5 to 1 centimeter. The posterior fontanelle closes significantly earlier than the anterior one, typically between 6 and 8 weeks, which is about 1.5 to 2 months. This chart summarizes the differences between the anterior and posterior fontanelles, highlighting their location, shape, size, and closure time. In a quick check, the anterior fontanelle is diamond-shaped, and the posterior fontanelle closes between 6 to 8 weeks. The sphenoid or anterolateral fontanelle is paired and located at the pterion or temple area. It closes by 6 months and is rarely palpable in healthy full-term infants. The mastoid or posterolateral fontanelle is also paired and located at the asterion behind the ear. It closes between 6 to 18 months and is the last of the paired fontanelles to close. The key sutures connecting the cranial bones are the sagittal, coronal, lambdoid, and metopic, or frontal, sutures. The golden rule for assessment is to evaluate the infant in an upright position and when calm. Use the flat pads of your fingers for palpation. Crying can cause false positive bulging due to increased intracranial pressure. Normal variations include a slight, expected pulsation, reflecting the arterial pulse. A normal fontanelle should feel firm, flat, or slightly concave, flush with the surrounding bone edges. 3 major red flags in assessment are a bulging fontanelle, indicating increased pressure, a depressed fontanelle suggesting dehydration, and abnormal closure, pointing to bone or brain issues. A bulging fontanelle appears tense, firm, and convex, even when the infant is upright. This is a medical emergency that indicates increased intracranial pressure, or ICP. Causes of a bulging fontanelle include hydrocephalus, meningitis, intracranial hemorrhage, brain tumors, and hypervitaminosis A. A depressed or sunken fontanelle dips significantly inward below the bone edges. This results from a loss of fluid volume, which reduces ICP, and is a key sign of dehydration. If you observe a sunken fontanelle, check for signs of dehydration, such as poor skin turgor, dry mucous membranes, sunken eyes, and decreased urine output, like dry diapers for over 6 hours. A bulging anterior fontanelle in an infant is a cardinal sign of increased intracranial pressure. A sunken anterior fontanelle in a 6-month-old with diarrhea indicates dehydration. Early abnormal closure, known as craniosynostosis, is the premature fusion of cranial sutures. This restricts brain growth and can lead to a deformed head shape or microcephaly. Delayed abnormal closure, where the anterior fontanelle remains open after 18 to 24 months, can be caused by rickets, hypothyroidism, Down syndrome, or chronic hydrocephalus. Rickets, or vitamin D deficiency, causes wide, open fontanelles well past 18 months due to defective bone mineralization. Other signs include frontal bossing and craniotabes. Sometimes a third fontanelle is present along the sagittal suture. Its presence is strongly associated with Down syndrome, or trisomy 21. Congenital hypothyroidism slows skeletal maturation. The classic newborn triad includes a large posterior fontanelle, umbilical hernia, and prolonged jaundice. The anterior fontanelle normally closes by the age of 12 to 18 months. A third fontanelle is most commonly seen in Down syndrome. Makeswin's sign, the cracked pot sound upon skull percussion, indicates separation of sutures due to severe hydrocephalus or increased ICP. This slide provides information on common scalp swellings in newborns. In this checkpoint, vitamin A toxicity and tetracycline can cause a bulging fontanelle. The normal size of the anterior fontanelle is 2.5 to 4 centimeters. The nurse's role involves monitoring fontanelles at every visit, measuring the head circumference, educating parents that gentle touching is safe, and immediately reporting bulging or sunken fontanelles. To summarize, anterior is diamond and closes at 12 to 18 months. Posterior is triangular and closes at 6 to 8 weeks. Bulging means increased ICP, depressed means dehydration, and delayed closure suggests rickets or hypothyroidism. This revision chart visually summarizes the key characteristics and closure times of the fontanelles. Thank you for watching this video. Keep learning and stay consistent in your practice.